Hello and welcome to the Back to Life Chiropractic Health Score Workshop. This is our workshop that we would do for a group, but now we're making it so you can watch it online and have audio on it. So we're just going to go through the PowerPoint and go through each slide, and then this health score workshop is actually how to come up with a health score using your individual score sheets and then making a master score sheet. So all these are downloadable on backtolifechiropractic.com. So how did we come up with the Back to Life Chiropractic Health Score and the Back to Life system? Because the Back to Life system, the whole system, come up with a health score, have a cheat sheet, and actually start to improve it. And we just give you actually everything that you can do, so you can do it. But we came up with it. I started practice in 1994 as a chiropractor after getting hit by a TARC bus and not getting well, and then going to medical and doing PT and drugs and couldn't get well. Was going to get surgery. Went to the chiropractor, my Uncle Bob, chiropractor in Sellersburg, got well, and then became a chiropractor. So, with chiropractic, we choose not to do drugs or surgery. So the things that you're going to hear are for people that want to get well without drugs and surgery, or want to get off them, or get off some of them. So in 2009, we started a wellness practice with another colleague. So we actually combined about 30 years of clinical experience. And so what we wanted to do was we wanted to make sure we weren't contradicting each other. So we sat down and went through all our visits and everything that we wanted to do and how we treated people and the tests that we did. And then we found these wellness attributes. We were actually very similar in about everything we did. And then over the time, we've actually looked at some franchise wellness programs, and almost all these are almost the same, a few little differences and maybe in meal ratios and certain things like that. But these wellness attributes are what are seen in patients, and these tests and things are ways to find out a health score that will lead you to wellness. And so that's how we came up with it. So we came up with seven general areas of wellness, and it's nice because once you come up with your health score, then we have a checklist, and then you can actually start to improve your health and start to form a habit. Eventually form a habit, and then you don't have to do as many of the wellness scores in the checklist. So, don't get stressed out over the fact that this might be more complicated in the beginning, because as you get well and you do it, it becomes a habit, and it's actually quite easy. So what the health score consists of is you're going to have a master score sheet, and then the master score sheet's filled out with all these individual score sheets. And it's kind of nice because the seven wellness attributes are nutrition, cardiovascular, flexibility, strength, posture, nervous system, which is our autonomic nervous system, and your feet and arches. And so the grays are ones that you can do at home without any professional help or technology. So there's no really excuse for you not to come up with, a health score. Just the more scores that you have, the more valid your health score is. And then you're gonna want to get a score in each area, because each area affects the other areas and actually affects your individual health score. So what we're gonna do with this is we're gonna go through each wellness attribute, and then we're gonna go through each sheet and then figure out how to come up with your health score. So one of the things when you're starting to be healthy is to stay motivated. So we're going to talk about, attitude, why, you need to figure out why. Maybe write down 3 things why you want to do this. So when we have a new person doing our program, we ask them why. Write down 3 things why you want to do this. And the nice thing about this is once you get the attitude and the knowledge and the skill to do it, then you're going to create a habit, and then you don't have to always be going to a trainer or a gym or having a teacher. But it would be nice for you to start a group. One of our goals is for you to start a group and then start to train them. So this is Barbara and me. This is me when I was younger. In my first office, she was a wife, grandmother, clown, singer. She ran the nursery at church. She was the treasurer at church, office manager in my office for a while. But she did have COPD and emphysema from smoking. She did that her whole life. So, she was, starting to feel a lot better. She was feeling good. but when she was 65, she had chemical stress test, which plummeted her blood pressure, and then they couldn't get it fixed, and she ended up dying. So she was a big advocate of the wellness program. I was actually working on this program, trying to come up with this when this unfortunately happened. But one of the reasons we were coming up with this, because we were talking about that, she's like, I wish I would have known, like I wasn't in that great shape, or the things I needed to get more motivated not to smoke and to eat right, but she just never felt that way. So one of the nice things about the wellness score sheet is it tells you if you're in crisis, or it shows you might have like a false impression that you're well, but you're not. So she's one of the reasons, because I know so many people that in my life that if they were healthier or they could do more things, they could make such a bigger difference in their world. And then so that's one of the reasons why I came up with the Back to Life system. So everything that's on this workshop, everything in this workshop's on our www.backtolifechiropracticky.com, and if you click on the tab Back to Life System, you can download all the forms, all the checklists. It has videos, it has every companion form you need to have, it has a workbook, it has everything that you need to do this, so you have no excuses. So do you believe your health attitude affects your health choices, which affect your health? So what we see here is, when I was younger, I used to take care of some of the WWE, OVW wrestlers, but these guys made a choice to be bigger and stronger, and so their health attitude affect their health choices, which affect their health. So it does. So, and then these people decided that they wanted to lose weight, and so they got they got back in shape. They actually fit in his pants. So I love that picture. So, so one of the nice things about coming up with a health score is we know that there's a health scale. So you want to be at optimal health, 100% function, where you have continuous development, active participation in a wellness lifestyle. On the health scale is good health, regular exercise, good nutrition, wellness, education, minimal nerve interference. A lot of people are in this zone, the comfort zone, which is called false wellness. You're maintaining health, you have no symptoms, your nutrition is inconsistent, your exercise is sporadic, and your health is not high priority. Poor health is symptoms, drug therapy, surgery, losing normal function. And then, the last is illness and crisis, which is disease, where you have multiple medications, poor quality of life, potential becomes limited, and your body is limited function. So, when would be the best time to move toward wellness? And in which direction would you like to move toward? Because you either snowball one way or the other. You just don't stay in one spot. And where would you rate your health on this chart? So, getting one test, or getting one medical exam, or doing maybe really good in one area, doesn't always tell you exactly where you are in this health scale. So you might have a little bit of a comfort zone with false wellness. Or taking prescriptions and being able to do stuff, really is false wellness, because you're not really well. So, the best time to move forward is now. So, so you're either going to snowball toward this way, or you're going to snowball toward this way. So, are you ready for the stresses in your life? You're always going to have some stresses in your life. So, so when it comes to stresses, is your architectural, your frame, your body, your temple, is it actually ready for these stresses? Because they're going to come. So is it an organized, scientific, researched, proven over time, the things that you're doing, is it going to take the stresses in time, or are you going to be a hodgepodge of medical advice, things you've watched, things you've heard, things you've tried, because eventually, with the stresses come, if you, have damage to your body, and then, all you're doing is spending your time, mopping up, the acute, you're just mopping up problems and symptoms. So it's acute care. You're always just, taking medications, or you're getting something, surgery. You're doing something all the time just to mop up crisis. Or can you repair your body, and then, can you actually prevent the things that cause the storms, that cause damage to your body, that actually cause, destroy your temple and make you have symptoms. So preventable illness makes up 70% of the burden of illness and associated expenses. So, we know we're in a healthcare crisis, and a lot of people are in debt. Insurance is going up because of all the problems and expenses. But the nice thing to know is preventable illness makes up 70%. So that means only 25 to 30% of your problems are genetic. So, there's a lot you can work on. And then if you do have some tendency for some genetic problems, then, you need to be working on the 70% even more. So anytime you do a program where you're going to change your health and start doing exercise and eating right, it's always good to get a physical wellness assessment done. So we actually perform physicals and exams in our office, but you just need this is a nice form to download, and then have it filled out by your your healthcare provider. So please get this done before you do anything. So let's get into the test. So this is the master score sheet that you're going to download from the website or get from our office. And these are the categories: nutrition, cardiovascular, flexibility, strength, posture, nervous system, feet and arches. Remember, the grays are the ones that you can do without a healthcare professional or any kind of technology. And so you want to get some in each area. The more you have, the more valid your score is. You can always, the nice thing about this program is that you can add other tests. So if there's another test that that you get from a medical doctor, from your personal trainer, or from an app or something, you can actually add that in here, and it just makes your health score more valid. And you just got to throw it in here. So so the first part of the health score is nutritional. So we're going to go over BMI, BM. We're going to use some outcome assessments, balancing biochemistry, the Nutri-Tech, and then we're going to do pH and Zyto. So this is the first area you're going to start working on. So BMI, so that's your body mass index. A lot of people have heard about this. So you're going to put in your height, your weight, and then if you go to Back to Life Chiropractic KY and you actually go to the nutritional category and to the Back to Life system, ask calculator, and you just throw it in there. And then, or you can look it up and Google it, but you just need to get your BMI. So, because this is a good indicator of how nutritionally you're doing. And so what you'll do is you'll get your score and you'll just throw it in here. So, if it says, 18 to 24, 18.5 to 24 is well, 25 to 29 is average, and 30 and above is crisis. So, you're just gonna check this, and then you're gonna put this score here, and then you're gonna save this later when you do your other health score. And then this part here is more for when we do coaching, or we work in a group, or we do our programs. We actually check these, and we schedule people back in to recheck it. And so it depends where you are in your score and how often you have to get this done. So BM is bowel movements, and bowel movements are a really easy, important way to figure out how nutritionally you're doing. So your stool should be brown or golden brown and be formed and have texture similar to peanut butter and have a size and shape similar to sausage. So if you're getting this type of bowel movement every day, then you're going to be normal every day. You're going to have a wellness preventive score. So you're going to score yourself a 3. If you're getting watery stools, you're going to be in sickness and crisis. Or if you're only having like one a week, or they're not formed right, or they look different, then you're going to be in crisis. So so you're just going to evaluate that, put that down, and then you're going to write your score. The next is the balancing body chemistry assessment, which is another nutritional test that's symptom based. It's actually a computer program, so you'll have to fill out this form, turn it in either by email, or you can drop it off or mail it to our office, and then we can have it scored for you and send it back. But this one's nice because it's all based off symptoms, and it checks your different systems of your body. So it's classic symptoms that they're going to ask you, do you have them all the time, or do you have them just a little bit, or do you never have it? So, and then you just write that down, it comes up with a score. So, but it'll tell you about your blood sugar, your nervous system, your digestive system, sugar handling, hormones, thyroid, adrenals, but it'll give you a score on that. And so, but the important thing about this is you only want to go back the last 3 months, not your whole life, because it's symptom based, so you want to know what's going on the last 3 months only. To take your score, you shouldn't really have anything in there, or just maybe a little bit. So prevention wellness is 0 to 5, 6 to 12, and sickness is 13 or above. And you write that down and save it. The next test is another version of a symptom survey that you can have a score, but it doesn't have to be done by a computer program. Each little category actually has, you score it right then and there. And so you'll have sympathetic dominant, parasympathetic dominant, sugar handling, cardiovascular, gallbladder, digestion, hyper and hypo, thyroid, pituitary, adrenals, and then hormones. So, take that, score it up, and then you shouldn't have anything really on that. So, but if you do, then mark your scores there. So pH balance. So the pH balance is a great way to check to see if you're acidic or alkaline. It's a good way to see how you're eating and breathing, and sometimes supplements affect this, but nutritionally it's a good way to check your chemistry of your body. The more inflamed you are, usually the more acidic you are. And then so what you're going to do is you're going to urinate in the cup, you're going to dip the pH strip and then read it with a marker. And you can get these pH strips at any kind of health food store, online, or at our office. So, but you just don't do the first, you don't want to do the first, P of the day. You want to do it anytime after that. And so then you just write that down. And the normal 7 to 7.5, the average is that, and sickness is 4.5. So just write your score, and that's just another great test that you can do. The nutritional test Zyto. The Zyto is a computerized high technology program that reads your galvanic skin currents. And so what it does is stimulate certain points on your hand, reads to see how long it takes that current to come back to that point. And then it can show you which areas and which organ systems are in your body that aren't functioning properly. And it tells you what services and supplements you can do to improve that. But the nice thing is it'll show you where you're out of range based on this. And then one of the nice things about the Zyto, it is reading you based on what's going on right then and there, and what's kind of going on in general with your body. So it's just nice right then and there. This is what's going on indicator. So you just take your results, and if you have a couple out of range, then you're going to be in sickness. You really have like 1 or 2, you'll be average. Then we really shouldn't have anything on there, so no results would be there. So the next nutritional test is your hip waist ratio. So you're going to have a measuring tape that's more cloth. You can get those at any kind of store, and they're very affordable. But you're just going to go around your abdomen, around your belly button, and around your hips. And then the important thing with this is you should put your feet together or have them slightly spread out, but you want to do it the same way before, and then when you retest, you want to make sure you're doing it the same way. So so you're going to take your hip measurement, your waist measurement, you're going to divide them, and then it'll come up with a score. And if you're female, you got to look at this part, and if you're male, you're going to look at this scores here, and then it'll show you if you're low risk, moderate risk, or high risk. But this is picking up your visceral adipose tissue, and your visceral adipose tissue it's an endocrine system which causes estrogen, inflammatory markers, clotting factors. So this is important, an easy way to figure out your nutritional health. So the next wellness attribute area is cardiovascular. And the cardiovascular, our tests are blood pressure, target heart rate test of submax step test, and the 1 mile test. And so the cardio test, you're just going to get your blood pressure done. So you're going to find your systolic, diastolic numbers, and then you're just going to plug them in. So less than 120/80, you're going to be well. If you're in this range, you're average, and greater than 140/99, you're going to be in sickness. So that's a nice, easy way. You can usually get those tests done either at your medical office, or you could buy a machine, or you could go someplace and get that done. The cardio test, target heart rate, submax test with a step, is you're going to have a heart rate monitor do this. But the nice thing about this is you're not overexerting yourself, so it's a kind of a safer way to check your cardiovascular health. So you take 220 minus your age, that's going to be your maximum heart rate. And then what you're going to do is you're going to step up on a step that's 6 to 8 inches. And then you're going to do counts of 20. You're going to go up, up, down, down, up, down, down. And then you're going to do 20 sets in a minute. So you do this 3 times because you're kind of getting yourself at a pace and make sure you're doing it right. And then when you get to the last one, you're actually going to take your heart rate and then you're going to write that down. And then you add 75 to that, and that would be your submax test. So if you're poor shape, when you add that up, you'll be 20 over. If you're just 10 over, then you're average, and then if you're excellent shape, you should be less than 10 over. So that's just a nice, easy way to figure out if your body's dealing with stress. It's safe. The cardio test, you can do this. This is a good test if you're on medications or if you don't have a heart rate monitor. You just have to figure out a mile. So you can either do it on an athletic field, that's usually 4 laps, or you can go figure out the distance. Or nowadays, like a lot of the watches and and the phones will do GPS, and you can figure out a mile. But the important thing about this is you don't want to jog or run. You just walk as fast as you can. And then you just write down, if you're under 40, you just figure out where you are. If you're a man here, woman there. If you're over 40, men here, women here. And then you're just going to write down your time. And then you can see if you're, sickness, average, or prevention. Flexibility. Flexibility is another wellness attribute that's seen in people that are well. And so range of motion is the way you test flexibility. Flexibility is the key to youthfulness, I always say. So the way you test this, we're going to test your spine in this case. And so you can either do it by eyeball and just look at it and have someone look at you and do it. Usually this can be real obvious that you're not working, you're not turning, your range of motion isn't as good. Or you can actually, as you get better, you can have it measured. We use the Millennium range of motion, but it's a computerized system and just gives you a score and tells you your impairment rating. So, but the main thing is you need to do each range of motion in your neck and your mid back and your lower back. So you're going to bend. So for your neck, you're going to put your chin to your chest. Then you're going to go back as far as you can. You're looking at the ceiling. Then you're going to turn your head to the left and then turn to the right. And then you're going to put your ear toward your shoulder to the left and then to the right. That you need to keep your nose straight. So that'll show you your range of motion. And then your mid back, you're bending forward, you're bending at the weight, at the mid back, and then you're rotating left and right, this is a little bit hard to do. So the easiest way to do is just see how far away you are from the floor when you try. You keep your knees locked and see how far you can go. So, but if you're 5 inches or more, you're in crisis. 5 inches or less, average, and then if you can touch the floor, then you're wellness, which is a 3. So your low back range of motion. Bending, keeping your knees locked, trying to touch the ground, then you're leaning back with your knees locked, and bending left and right, like you're sliding your arm down your side of your leg. So this is a good indication of your range of motion of your spine. So your spine is so important because of your nervous system and your ligaments and your muscles and your posture all kind of, you can see this is a good indicator of how that's functioning. So. And then your muscle tone. So then the nice thing you can do if you want to, you can add other joints in your body like your elbow, your knees. I mean, you can add more testing. That's one of the nice things about the health score. But this is the main thing that we're concerned about is your spinal range of motion. Strength is the next wellness attribute. This is probably the hardest one to test because we found out, a lot of people can pull off and consider, and look pretty strong, even though they're not, just because they had to do it that one time, and then they might be sore for the next couple of days, whatever. But so the strength test is one of the few tests that you have to do weekly. But the minimum resistance, upper, lower, front, and back is one of the tests, and then the surface EMG is a computerized test that we're going to talk about. But those are the 2 tests that we use for strength. So the strength test is minimum resistance, upper, lower, front, back. So we're trying to do the whole body. Make sure you're doing resistance. And then we're actually using a sheet that you can download at backtolifechiropracticky.com, but it just has all these. It shows you how to do each of these exercises, and so biceps, the bench press, triceps, reverse fly, quadriceps, hamstrings, calves, neck muscles. You're using the synergy ball. The strength test, you're doing abdominal exercise, and then you're doing sit-ups. You're doing sit-ups, and then back extensors. You're doing the Superman exercise and elastic band extension exercises. But the key with this is, you should be doing these 2 or 3 times a week, and then you should actually, doing some resistance. So, you need to be doing 10 pounds, or most elastic bands, the blue is usually 10 pounds. So you need to be doing these, at least 8 times. So, if you're doing this, and you're doing the resistance, and you're doing this 2 or 3 times a week, then your wellness prevention average, is less than 2, or you're not doing it, or you're not doing, the right amount of resistance. And then if you're not doing anything, you're in sickness and crisis. So these exercise sheets here, you can download from our website. The Surface EMG strength test it reads your electrical currents, your electrical output of your muscles. So you put little sensors on each side of your spinal extensors, and then it reads how much nerve electrical output's going in, and then if there's a difference from side to side. And so it's kind of nice because it's going to help you see. It kind of helps evaluate your posture, your nervous system, your musculoskeletal system. And so, reds and blacks are the worst. So if you have those, you're going to be in crisis. Blue and green's average, and white is wellness. And then a lot of the tests will just actually give you a score, and it'll tell you where you are on this. So in an example here, this person is in crisis with their neck muscles and their upper back muscles, and around like T9 there. So that's a nice test to figure out your strength. So posture is another wellness attribute, and posture is super important because even if you're super flexible, or you eat super great, or you're really strong, if your posture is bad, you're still going to have strain on your muscles and ligaments, and you're going to put strain on your disc, and you're going to be wasting a lot of energy. So, posture is one of the things that actually probably brings people's scores down that are really healthy, and causes a lot of problems, and prevents a lot of people from going farther in their exercise programs because, they're getting strains of brains due to posture. So this is a really important wellness attribute, and people that are well have usually good posture. So visual posture is one of the tests, and the x-ray analysis is another way to check your posture. So posture visual. So when you look at someone, and then you're going to want to do this, either professionally have someone do this that looks at posture, like chiropractor, or physical therapist, or an MD, but you need to either have someone look at you or have it done professionally. But your eyes should always be level, and on the side view, if you drew like a line through your ear and straight down, it would go through your shoulder, through your hips, through your knees, and through your ankle, and then you wouldn't have any big huge gaps in your lower back or in your neck, but you should have a little slight gap. So, and then on the front view, you're going to want to have your eyes level, your shoulders level, hips level, knees level, and your ankles level, and your feet should be slightly flared out. So, and this is pretty obvious. Usually when you look at this, you'll notice, if something's normal, you go, head's normal, shoulders normal. But if the head's really forward, then you just wouldn't check that because that's abnormal. Or if you saw one shoulder a lot higher than the other one, then you wouldn't check that. Or if the head was tilted, or one foot really flared out, So this is an easy way to see if your posture is correct. So if all regions are normal, then you're wellness. If 1 or 2 are unchecked, then average. Then you have several unchecked, then you're in crisis. So another way you can see this, sometimes you just had x-rays taken, or some people are having problems and they feel like they're doing as much as they can, but they're still having problems. Then x-ray analysis is always a good way to figure out your posture, because you can measure and actually see someone has, you know, a scoliosis or a femur head inferiority, or they have, you know, anterior weight bearing of their neck. So, you know, so you just get your x-rays, have them, you know, looked at and measured up, and then if they're normal, check them, and if they're not, then you're in crisis. But x-ray evaluation is a nice way to see if you have any congenital problems, that sometimes, you know, you have a fusion somewhere, or, you know, or maybe you're older, you've had some trauma and you have some arthritis, you know, but it's areas that you can see that maybe, you know, it's keeping you from moving farther in your programs, or one of the reasons why you can't be as flexible. You know, an example here, this person's had spinal fusion, so, you know, that's going to prevent them maybe getting completely, you know, well in one area. But I mean, it's just nice to know what's going on and see how your posture is, and then maybe you could do more things to correct it or change it. So x-ray analysis is one way to do that. So now we're in the nervous system. The autonomic nervous system is important because your nervous system controls every function and organ and cell in your body. So you want this in balance. So we're going to use the Nutritech survey form, the thermal scan, and the pulse wave profile. So, you know, one of the things that we hear a lot about is, you know, why I have to worry about my nervous system. But, you want to see where you're having interference to the triad of your health, which is physical, chemical, emotional, which is what we're working on. But you need to work on all three of these. And so, you know, your nervous system is made of 6 systems, which are kept in balance by your parasympathetic and sympathetic nervous system. So one's slowing you down, one's speeding you up. So when this gets out of balance, then, you know, you're going to have health problems and disease and tissue damage. You know, each spinal nerve root goes to certain organs and tissues of your body, so that causes symptoms. So, one attitude is that, you know, interference here or in your triad of health, what you're eating or what you're thinking or your body structure is interfering with your health. So, you know, one attitude is that you're going to correct this by making lifestyle changes, and one is like, oh, I'm going to give a prescription. You know, I have stomach problems, so I'm going to take a medicine, or I have a headache, I'm going to take a medicine. You know, but is that really correcting any problem or taking pressure off or removing interference in any of these areas? No, so you're just going to keep getting worse and worse. You know, it's a false wellness. So, you know, in other attitudes, you need to have your autonomic nervous system in balance. So the reds are always trying to calm you down, and then the blues are trying to speed you up. So this needs to be in balance. And if you've been out of balance for a while, you can see where these systems are going to be out. So that's why we're doing, you know, the symptom surveys and the galvanic spin, you know, currents, and we're doing the spinal analysis of the muscles, and, you know, we're doing a lot of things to figure out where this might be out of balance. And so one attitude is that we need to remove the interference, not by prescriptions or surgery, but by making lifestyle changes. So, you know, one of the key things for nervous system is that your brain is one of the first things that forms, that controls all the other functions of your body. So it's important to make sure that your nervous system is working correctly. So all these electrical impulses come from your brain and down your spinal cord, and they're kind of like wires, but they're very delicate. They don't like to be interfered with at all. So, you know, if this is all working properly from your brain down your spinal cord out these nerve roots, then everything's working properly. But if you have a little rotation or interference or arthritis or chemical irritation, then this will not work properly. Even mental thoughts will affect this. That's on our Think Well workshop. But then you just won't be functioning as properly. And so, you know, you want your cells to be functioning 100%. So that's why it's so important to check your nervous system. So your nervous system, the Nutritech symptom survey form, the first two, the SD and the PD, stand for sympathetic dominant and parasympathetic dominant. So that's your autonomic nervous system. So these are classic symptoms for, you know, are you in the flight-fight mechanism, or, you know, you're more sympathetic or more parasympathetic. So you just fill out those questionnaires. Remember, you're only going back the last 3 months because symptom-based. and then write down your score. So you really shouldn't have anything on there. So 0 to 5 is wellness, 6 to 12 is average, 13 more is sickness and crisis. So that's something you can do without any, computerized test. Now, a computerized test for the nervous system is thermal scan. So skin temperature is affected by your autonomic nervous system, and so what they do is they roll a little scanner up that reads skin temperature from side to side, and it'll see if it's abnormal or if it's different from each side. And so blacks and reds are in crisis in this example, blues and greens are average, and the whites are wellness. So you just have to go to a diagnostic center. Our office does it, Back to Life, but there's a ton of, well, not a ton, but there are a lot of offices that do thermal scans. So you just can find one in your area. If not, we could try to help you. But an example here, C1 and C2 and C3 are in reds and in crisis. So C1 is your atlas. So that's where your parasympathetic nervous system would calm you down. So this person usually probably has more emotional, they're having a lot of emotional stress going on. C2 sinuses, like T9, I'm not sure what that is, but that's usually adrenals. You see those a lot on people. But you can actually see the different organ systems that's going on. So in this example, you're gonna be in sickness and crisis because you have a couple of reds here and there. So, or you'll be at average, but you really shouldn't have any reds or blacks on this at all. The next autonomic nervous system test or nervous system test is the HeartMath pulse wave. So the HeartMath pulse wave is a test that reads your your pulses, your inner pulses. So, and it actually reads how you breathe. And so your breathing and your autonomic nervous system and your pulses actually show how healthy you are. And so what you want to do on this is you just put a little heart rate monitor on your finger, like a little pulse monitor, and it actually reads the inner pulses and how many beats per minute it is, and so it'll give you a score. So high coherence score is good, low is bad, and so if you score from 80 to 100, then you're well. Average is this, and sickness and crisis is over here. So this is a nice high-tech way to see if your nervous system is imbalanced. So, and then the last wellness attribute is feet and arches. So feet and arches, you might ask why that's on there, and why isn't it posture? But feet and arches actually affect a lot of different areas, and so we made it a separate thing. And it's one of the things that we saw, in a lot of people that are well or sick, is their feet and arches. So, we test this visually and by the foot leveler scanner or any kind of scanner. You can do this. But what you want to do when you get a scan, for example, the foot leveler scanner we have, it actually is a laser scanner, and you stand on this and it scans your foot. But you're looking at 3 different arches. There's 3 arches in your foot, an anterior, a medial, and lateral, and these need to be perfect in order for your foot not to rotate in, or your hips or knees, because we'll talk about that a little bit. So, but you can, once you have the test done, you can see where the pressures are. So for example, this one on the right, it's lost its arch here. So that would be one foot, abnormal, one would be normal. So that would be average. You just take your scan and score that. And then if you're wearing orthotics that are custom made, then you can score yourself, normal. But that's if, you're wearing them all the time. Some people don't wear their orthotics all the time, so then you're not correcting the arches. Or if you don't have custom made orthotics that were made just for you, sometimes they overcompensate you or they're too little, so then you still would be off. So it's kind of important to have custom made ones. So you can actually test your arches of your feet visually with like 5, you're going to see about 5 things that would be wrong. So when you're walking, see if one of the foot flares out, because that's just showing that, your arch has dropped. You can look at your Achilles, see if it's bowing, because that'll show you if your arch has dropped. If your knees are rotated anteriorly, then your arches have dropped. And then you can look at your shoe patterns, see if they're wearing, in one way or the other, more on one side, because that'll show you that your arches have dropped. And then you can put your finger underneath the arch, and that, should fit in there. So those are, if you have a bunch of those going on, then you probably know that your feet are not normal. So then, if both feet are normal, click that. If one foot's normal, click that. And then if both feet are abnormal, then click that. So, and then if you're wearing orthotics that are custom made, then you can click normal there. And you're wearing them, of course, all the time. So, but the important thing about this is, even, if if you lose these arches in your feet, then you're going to rotate your foot in, your knees in, your hips are going to go in, then you drop your sacrum, which causes your spine to have a curve, which puts a lot of stress on your ligaments and disc and nervous system. You're going to start having knee problems, shoulder problems, even shoulder problems. So that's your posture actually could be pretty good, but then you could lose your arches of your feet somehow, or vice versa. So that's why we separated the feet from the posture, because these can happen different times, or one can affect the other one. So it's just really important to always be checking that too. So now that we've done all our tests, hopefully you've been able to do a test in each area. The more tests that you do, the more valid your health score is going to be. So then you're going to sit, you've sat there, you've done each test, and then you've written your score down. So now what you're going to want to do is you're going to write down your scores in each area. So for example, BMI, let's say you've got a 2, your average on that, so that would be 2 out of 3. Then let's say your bowel movements were 2 out of 3, then you would put 2 out of 3. Your hip waist ratio, it was like 1 out of 3, then you would put that down. Let's say you didn't do the balancing biochemistry, so you would just leave that blank, so that'd be 0 out of 0. And then if you did the Nutritech, and that was 1 out of 3, then you put that down. pH, it was 2 out of 3. And let's say you didn't do the Zyto, so that would be a blank there. Then you just keep, putting these in here. So blood pressure, you would put, you just got to keep putting these in. The nice thing is, if you have any other tests that you have done, are you checking other things like sleep or some from an app, then you can throw that in there too. So sleep would be nervous system. So so the nice thing about your health score is you can actually you're gonna get a score, overall score, and then you're gonna plot that down here. So what you'll start, you'll actually know what your health score is and where you are on this. So a lot of times it just wakes you up, because you might be down here in average and you thought you were really well, or you might be even in sickness and crisis. I would say the majority of people that do these tests generally run in the 60s and 70s, even though they think they're over here, because they haven't taken, the nice thing about this is you're not just doing maybe strength and flexibility. You're actually looking at posture, nervous system, and nutrition. Or some people will just look at nutrition, but then they don't think about their posture and their their cardiovascular health. So it's nice to get an overall scale based on all the wellness attributes, not just one or two. But then it's nice, we use it when we coached or coaching or our programs, because we can see what areas we might need to work on a little bit more. People have limited time, or but it's just nice to see an overall picture in each category, but then get overall health ratio score, and then then you can start working on that over time. So at the end, you're putting down as many tests as you can, then you're going to divide up from the other score you had, that will come up with your wellness score, and so then you'll just see where you are. And then it's nice, because a lot of times people are shocked where they are on here. They're not as healthy as they are. So, and hopefully you are, but you have a place to start, and then hopefully it gets you motivated to keep going. But without a health score, then you really don't know where you are. I mean, you're just kind of, really, a lot of times you're in false wellness, or you think you're well, but you're really not. Or people around you, a lot of people think they're well, but then you really know they aren't. So if you can get them to take the test, then then they'll know that they're in crisis. It's not you just telling them that they're not doing well. They actually have a test that shows them that they're not well. So your health attitude does affect your health. And so do you want to go through life with a car like this, where you're always fixing it, you're always having problems, or are you going to start, having a car like this, where you're not taking a lot of prescriptions, you're not having to do a lot of maintenance, and so, you're always going to snowball one way or the other. So, a lot of times with the wellness score, it takes a little while to get going, but once you do get going, then you'll be doing okay. So the back to life system checklist health score is the next thing you would want to do after you got your health score. So the checklist actually just starts you to form habits of exercise and eating right and stretching and strength training and flexibility and helping your nervous system. But it's a nice little checklist that you just follow. It's kind of like a cheat sheet to health. So it looks a little complicated, but it actually is quite easy once you start to do it. But the nice thing is it starts to form a habit, and it helps you realize the things that you need to do to be healthy. And these are actually just the fundamental things that you have to do to be healthy, is this checklist right here. So this is the next workshop you would want to do, and it has all the categories and the prices and the forms that you need to do. It's just a nice little form. So, and then, if you're doing everything you can do, but you're still having problems, then we do have a Get Fit program, a Back to Life system, which is all this system. Everything, it does the wellness score, the checklist, it tells you everything to do. It has massage, it even has blood work. I mean, one of the reasons we know this program works, because when we do the blood work, people's cholesterol get better, people's sugars get better, their inflammatory markers get better. So, this is, we know that this works by all these different tests that we've done over the years. So, but the nice thing about our Get Fit program is, you do everything, and then you start to form a habit, and then once you've formed your habit, then you don't need, you should be able to do it on your own. And so, not everyone needs to do the Get Fit program. Maybe only one or two people maybe need to do that a month. But the rest of you, if you would just follow the Back to Life system and get in a group, then you could actually do quite well. So we have two community programs. One of them is the Get Healthy game. So it takes the health score and the checklist and just makes it into a fun, easy way to compete against people at your work or in your group, or your church or your family. But you can use the score sheets, and then you can come up with prizes, because we have a lot of these healthy products on our online store. So don't forget, you want to watch the cheat sheet workshop, so you're making the right decisions. And so that's the next thing you want to do. Good luck.